Hello, and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and I'm joined today by pediatrician Dr. Michael Donnelly. Summer has just started, children are out of school with new routines and new schedules. And today we're discussing tips for keeping children safe during the summer months. This season is filled with so many fun activities, but with it comes the hot sun and rising temperatures. Today, Dr. Donnelly will be talking with us about summer safety and children. If you'd like to learn more about navigating these warmer months and tips to keep our children safe while they enjoy the summer, then stick around, share this broadcast with your friends, and ask your questions for Dr. Donnelly in the comments below. Dr. Donnelly, welcome and thank you for joining us. Before we begin our discussion, will you tell the viewers a little bit about yourself and the work you do here at MedStar Health?
Sure, Sarah, and thank you for having me. It's great to be here, and it's great to be able to talk to all of you. My name's Mike Donnelly. I'm trained in both internal medicine and pediatrics, so I'm board certified in both adults and children. I've worked in the primary care space now for kids and adults for 20 something years here at MedStar. Came down to MedStar Georgetown 21 years ago and have lived down in the Northern Virginia area since that time. So it's been fantastic. By way of also introduction, I am the chair of the Georgetown University Department of Pediatrics, and I'm the executive director of the pediatrics service line throughout all of MedStar. So that keeps me busy in my free time. And yeah, so that's most of what I do. So I'll turn it back to Sarah.
Great. Well, we really appreciate you being here again today. So let's get into the questions. So, like I said, the summer has officially started, and many of us are eager to get outside, soak up the sun. But these summer months can bring a few areas of caution, especially when it comes to our children. So, let's start with car safety. We're all very busy, and many of us have new schedules and routines. So, car safety is important to keep in mind. You hear horror stories every year. So what are some tips you have for parents to remind them to make sure they don't leave their children alone in the car?
Yeah, first, this is a really important thing because obviously this is a tragedy that can happen to anyone. It's a really terrible thing. And really, it's just any distraction, just one single distraction can really lead to this. So it's really a really high stakes thing. That's something we do every day. We take our children somewhere in the car and we rely on getting out of the car and going in somewhere. And in the summertime, it's a terrible thing because the car heats up far faster than we would ever think, especially like yesterday where we had a 98, 90, 100-degree day. So some habits to help. One, always just make a habit of every time you're in the car and you're driving, or even if you're sitting in the front seat, always look in the back seat before you get out of the car. You always do a visual double check and make sure that whether you have anyone in the car, whether you have a child with you or not, you're just checking anyway. Another helpful tip is if you keep your either cell phone or your bag or your purse in the back seat with the child, then that's actually helpful too because no one forgets their cell phone. So it's a really helpful thing. If you're keeping something in the back with the child, then you know you have to get that as well, and it creates that habit as you're going through it. Another thing is even when you're not driving, when you're parked in the driveway or anything like that, to keep the car locked when you're parked. And obviously it'll keep it from getting stolen. But one tragedy is that children sometimes climb into play and then they get stuck or they can't get back out. And so just keeping the car locked when you're playing and teaching your children actually that playing in the car is a no-no. You're not allowed to play hide and seek. You don't go in the trunk ever because especially in smaller cars, you can't see in there. So those are things to teach your children right away. One other thing, if your child is ever missing around the house, there's two things you check first and second. And if you have a pool in the backyard, you check the pool first, and then you check the car second. And that's what most safety experts recommend. So those are the things I think that those are the tips that I think can help you not have your children be left in the car.
Yeah, those are some really great tips. And I know some newer cars, they now have like you close the door and it'll say like check the back seat, like a little sensor goes off if they sense weight in the back seat. But obviously not all people have those kind of cars. I know I don't. So yeah, I'd really like that tip, especially, keeping your purse or something back there so that, like you said, you're always turning around before you get out of the car just to be safe. So yeah, those are great tips. Thank you for that. And then as a bystander, what should you do if you do see a children or a child alone in the car?
Yeah, so this is scary when that happens. And obviously, it depends. If it's a cool fall day and it's not 110 degrees, you don't want to leave the child, but you also don't need to call 911 right away. But if to you the child either isn't responding or appears in pain or is unresponsive, you would call 911 immediately. So that is pretty simple. If the child looks like they're in distress, then obviously that's a 911 call right away. If you can, and if they look like they're in distress and you can get them out, then that's okay too, because obviously, and cooling them down or getting them out of the sun would be helpful too. The tricky part is if the child is responsive, looks like they're okay, then really what should happen is you should stay with the child until you're able to get some help. So if you're in a parking lot or anywhere else, you can have someone else, go into the store and search for the driver or ask to make an overhead announcement, take down the license plate number and say, hey, you know, um, this child's in the car alone. And you can do something like that. But generally, staying with them until a responsible party comes would be the best thing to do. And then, obviously, for an emergency, you just call 911, and you can't be afraid to do that.
Right. Yeah. I was just about to say, I know stuff like that can be uncomfortable, but it's better safe than sorry at the end of the day. So just keep that in mind. If you do see something like this happen, that's like I said, better safe than sorry. So moving on, we talked about heat in cars. What about children playing in and around driveways? I know another common incident that can cause serious injury are front over or back over accidents, which occur when a vehicle is slowly going forward, coming out of the driveway, going into the driveway or a parking space, when they roll onto an unattended child because the driver doesn't see them. So, do you have any tips to help prevent this? And is there anything parents can do to educate their children on car safety?
Sure. Yeah. There's really a bunch of approaches here. One front that I'll just have one sentence on is the public policy side, and people lobby car companies to add and improve rear and forward cameras and anti-collision devices because for all of us who drive an SUV or a larger car, both the front and the rear blind zones are much larger than we think. And if you try to put a small box in front of an SUV and then you slowly back up to you can see it, sometimes that can be up to 10 or 15 feet that you can't see a shoebox or something else that's sitting on the ground. So it's really it's more than we think when we're driving, and we take for granted that we can see everything. But that's one of the things just on the car maker side. But for drivers and other adults, you always want to make sure before you pull out that you've identified, especially if you've seen children around the car, where all the children are before they're pulling out. And that is very critical. So some people advocate actually walking around the vehicle before moving it, especially if there's a bunch of kids playing in the neighborhood or there are a bunch of kids around, walking around first might be better. There's another incident that occurs sometimes is that toddlers, when you say goodbye to them, try to follow you outside. And so sometimes, even though some other caregiver is in the house, the child sneaks out the door and comes out to say bye bye. And so having a door alarm that will chime if the door is opened, and so that double ring alerts the caregiver in the house to say, wait a minute, there, somebody, the door opened an extra time. So door alarms are something that's very helpful there because that's something that is actually one of the larger causes for these injuries is somebody following a parent out to say goodbye.
Mm.
Other tips and tricks: parking lots. Never let your children walk alone. They're short and they're hard to see, and they're coming out from between two cars where you can't see them in between. So those are really important. And landscaping near your driveway or near your vehicle rights of way. So large hedges or bushes, they hide people and they hide everything. So it gives the driver's response time gets cut down sometimes in half or to an impossible state if you can't see what's behind there. So that's more on the drivers and the area type tips. And then for children, the simple thing is you teach them don't play in driveways, don't play in the parking lot. And if they see lights or engine or running noises, now that there are so many EVs in the area, but brake lights, they should immediately move to the side of the car. And that's one of the important things is, right, teach them that front and behind is very, very dangerous. You need to be way off to the side and then never ever cross a street or anywhere else from from between two parked cars, because it's just you're never able to be seen. So those would be the big tips to try to prevent this.
Yeah. Thank you for sharing those. Those are some other great tips. And at this time, I'd like to pause and welcome our viewers again. Thank you for joining us today. We're talking with pediatrician Dr. Michael Donnelly, discussing important safety tips to protect us and our little ones during these extremely hot summer months. We have more to share, so keep on watching. Share this live stream with your friends and loved ones. And if you have any questions, you can share those in the comments below. So let's transition into sun safety now. At what age is it safe to apply sunscreen, and how often should it be applied? And is that something that maybe changes with age or is consistent, your whole life?
Sarah, that's a trick question. It's a big topic too. So I appreciate that. And I'll try to keep this simple. One trick question I always ask my medical students is, what kind of sunscreen should you use on like a 4-month-old baby? And when they try to answer, I usually tell them, well, below 6 months, we try to not to have the baby in direct sunlight because you can put them under an umbrella. They're not mobile and you don't want them in the direct sun anyway. So hats, long sleeve, UPF shirts, etc. And if you had to, you can use a little bit of sunscreen on the face, so that's easy enough. But in the end, for younger babies, you try to keep them out of the sun whenever possible. But you can put a little bit of sunscreen. You don't want to slather the whole baby in it. But and then another question I've been asked dozens of times over the years of what kind of sunscreen should I buy? And obviously, the answer is one, the kind that you're going to put on, and two, the kind that will work, right? And all of them work if they're sold in the US. What we want to do is look at the SPF number, and SPF is sun protection factor, and that's how much of the UV light it protects you against. And most of the time, I would tell you, most people say it's okay above 15. I would say usually above 30 is what you want. Above 30, getting 50 or higher probably doesn't do much more than 30. So 30 and above is probably what we're looking for. And then there are two types. There's chemical sunscreens and mineral sunscreens. And chemical sunscreens have a bunch of long names that some people, for better or for worse, are a little afraid of, like avobenzone and oxybenzone, which oxybenzone you could argue you don't want to use anymore. And then there are mineral sunscreens, which are like zinc or titanium based. In general, and this is a personal preference, I would say that you want a mineral-based sunscreen for your kids. There's not great science behind that. So if you're using a chemical sunscreen, they're usually easier to put on, and the mineral sunscreens go on thicker, and they're the white goopy ones that are harder to deal with. But I have a little bit of preference for them, but there's not the best science for that. So in young children, zinc oxide, titanium dioxide, those are the mineral sunscreens. There are suggestions that anything with oxybenzone in it is not the best for your child's endocrine system, although most avobenzone or other chemical-based sunscreens are perfectly safe and perfectly fine. So some places, ironically, don't let you buy some of the chemical sunscreens because they actually kill coral, so they keep it off their coral reefs. But you do have to rub them in, and that's the other thing is for mineral sunscreens, they go on thick and you have to rub a lot so you're not bright white in the face. And that's the hard part.
Yeah. And then is that the same with spray too? You should rub that in even
Yeah.
though it is spray. Okay.
Yep. Still have to rub it in. Yeah. So
Just makes it a little bit easier.
it does. It does. It
Yeah.
makes it a little bit easier.
And then how about reapplying when you're at the pool or the beach? How often should that be done?
Yeah, so one, you should apply before you go out in the sun.
Mhm.
That's always a good thing. The chemical sunscreens, actually, you should apply like a half hour before you. I know No one has ever done this in the history of the world, but you technically should apply it about a half hour before you go into the sun. The minerals work right away, but you have to actually absorb some of the chemical for that to work. So um, before is better, and then about every 2 hours. And the general gist, and they've done numerous scientific studies on this, they watch people put on sunscreen, is people use about a quarter to half of the actually recommended amount that you need. So you really need to slather it on more than you think because people do not use enough. And so they may not be getting to the SPF 15 to 30. And that has been shown in so many studies that it's a known thing, and we just have to be careful. Like if you think that you're putting it on a little bit thin, then you definitely are putting it on way too thin.
Yeah. I've definitely learned my lesson a few times with that. And now I just lather it on. And if I'm greasy, I'm greasy. At least I'm not getting sunburnt. Um, and we know the sun is strongest between around 11 and 2 p.m. So trying to limit exposure during this time, I assume is important as well. Are there any products that can help? I know you mentioned hats for, little kids and sun shirts. Is there anything else or?
Yeah, I mean, there are a lot of different products. There's the free version, which is trees work. So shade is great. Any shade you can find is obviously fantastic. Umbrellas, that type of thing. For clothes, especially when it's super hot, you really want loose fitting clothing. Long sleeves are definitely better than short sleeves, right? So anything that the clothes are covering. And then if you're getting clothing and you know you're going to be outside a lot, especially if you're working outdoors or you know you're going to be out, most clothing has a UPF label. So unlike SPF for sunscreens, it's UPF for clothes. And that's ultraviolet protection factor. And 50 is a good number there. And that's going to protect you against most of the UVA and UVB rays. So, but again, as much coverage as you can get, broad bit brimmed like the gardening hats that you don't necessarily look like the coolest person in the world, but they work and they really protect your skin.
Okay. And now transitioning a little bit, still talking about sun safety, but let's talk about heat stroke. So, what is heat stroke and why is it more common and dangerous in children, which I actually did not know that it was.
Yeah, so it's dangerous to everybody, but it is more common in kids. And heat stroke is so there are varying degrees of heat induced injury to the body, and heat stroke is obviously the worst. And then before that comes heat exhaustion and varying, depends on how much your temperature goes up. So heat stroke is basically when your body temperature goes up by several degrees. Your body, you know, you feel very poorly when you have a high fever. And so if you have a fever of 104, that doesn't feel great. And your body isn't made to go much higher than that. So when you get up higher than that, some of the basic functions and the enzymes that work within your cells, they actually don't work as well, even if you're off by 4 or 5 degrees. So causes acid buildup, it damages tissue, so it tends to be pretty bad. So that's what happens. So we are made as humans to work with only a small temperature difference in our core body temperature, and as that heats up, it's bad. The heat stroke is worse in children because children are more apt to get dehydrated more quickly. So children, either adults with disability, non-verbal verbal adults, they're all at risk, especially in hot temperatures, of getting dehydrated. And dehydration, where obviously your blood flow decreases a little bit. So if you have less blood flow and you're struggling in that sense, then the body temperature difference is actually worse. So children get dehydrated much more easily, and that's one of the big reasons.
Interesting. Okay. And then what are some of the symptoms of heat stroke or a heat related illness? What should parents look out for?
Yeah, so and sometimes it's harder in younger children, but children will feel faint or they just won't look good or they'll start feeling tired. Usually children will be able to self-govern that and come over and say, hey, I'm not feeling okay. When it starts to get severe, sometimes you'll see decreased urination, you'll see muscle pain, and then most of the time they'll be thirsty and tired, but occasionally you'll see nausea and vomiting. So if you have somebody who's out in the sun and is exerting themselves and they start vomiting or feeling very nauseous, that's one sign of heat related illness. And that's a sign to get them out of the sun, cool them down, and get them hydrated right away. And then obviously more worrisome signs like abnormal breathing, or they aren't able to stand up, etc. Those are obviously the further along signs that are very, very concerning.
Yeah. And then you touched on this a little bit, but what should you do if you suspect your child is having a heat stroke? I know you mentioned taking them in, cooling them down. Is
Yeah,
that it, or would there be next steps, if the symptoms,
yeah, that's a great question, and it depends on the degree of the symptoms, right? If you have somebody who says I'm thirsty and I'm hot, well, bring them inside, get them some cool, a cool drink, and that should be fine. So heat exhaustion is more mild symptoms, and that you can, cool place or jump in the pool or just something to cool them down real quick. That tends to work well. Um, and then when it gets more severe, you really have to decide, is this something that's either a call to the pediatrician or a 911 call? Sometimes there are worrisome things and people are out, and we admitted a child to our pediatric intensive care unit last week with a very, very high temperature and heat stroke, and they needed hydration, and they were very, very sick when they came in. So the very severe symptoms, don't be afraid to call your pediatrician for concerns, or frankly, if the child is just down and not moving, then again, that's a 911 call. There's, no call to your pediatrician is going to overcome that. They need to go somewhere and probably get IV therapy, et cetera.
is there maybe like a certain amount of time it takes a child to kind of recover before you realize, oh, maybe I should take them to the doctor, or does that vary
That's
depending
very
on the child?
variable. I mean,
Okay.
obviously, if you see somebody, if you bring the child inside and they're drinking down a lot of, cold water or whatever, and they're cooling down and feeling better, you're fine. It's when you start to do those simple measures and they either keep getting worse
Mm.
or they're just as bad and they're not getting any better. Those are the times where you start to think about calling. So, you give it 5 or 10 minutes and you see, okay, are we getting better or worse here? And if you're getting worse, then that's a separate ballpark. And if you're getting better, it's probably okay to watch and just keep a close eye on them.
Okay. Good to know. Thank you for answering those questions. We'll move on now to the importance of staying hydrated, kind of going along with what we just talked about. Dehydration can be a concern during these hot summer days. Are there any tricks to make sure children stay hydrated? I know I, as a child, did not love drinking water. So,
Yeah. I mean, there are tricks, but they're not great, right? Frequent water breaks are fine. Some like really sugary juices don't actually hydrate you that well, so it's not quite that helpful. Even straight Gatorade has a lot of extra sugar in it, so that's probably like if you cut that in half, half water, half Gatorade, that's probably a better drink than just straight some of the quote hydration drinks have a ton of sugar that's just excess and you don't really need relative to the electrolytes and the water. So, but for everyone, but until the baby's until the baby's over 6 months, plain water is fine for kids. And I often tell people that, both from, you don't need a ton of extra calories in your hydration, and you don't need a ton of anything else. So, but trying to schedule frequent water breaks and just being mindful of, okay, you've been outside for 10 or 15 minutes, come in, get some water, then go back and go. Trying to do it in a frequent, 10 to 15-minute fashion should be fine. For babies, it's just you can do a little bit of extra breast milk or formula, especially if they're out in the hot weather. But again, no regular water under about 6 months of age. After 6 months, you can give an ounce or two, and that should be no problem. But in general, that's the way, under 6, we don't do that. And then for older kids, just schedule some time.
okay. Yeah, my dad would make me sit on the couch. He put a couple water bottles in front of me, especially, before soccer games in the summer. He said, "You're not leaving until you drink all of these." So, is there any rule of thumb for parents to follow in terms of fluid intake?
Yeah. Again, on a really hot day, you should be taking a break every 20 to 30 minutes minimum to, and as your dad did, you should maybe hydrate before you go outside. So, pre-hydrate and then hydrate while you're outside, and make sure you're mindful about continuing to hydrate during that time. So, Again, 20 to 30 minutes is perfectly fine on the soccer field or on the baseball field or whatever somebody's out there doing. Even when you're out there, in the pool all day, you can get dehydrated in a pool. So it is possible, because you're being active, and unless you're drinking the pool water, you're certainly not getting any fluids. So
Yeah.
it's important to remember that too for even water play.
Yeah. And then you touched on this a little bit earlier, but I think it's important to go over again. How can you tell if your child is dehydrated?
Yeah, so again, normally most children will complain that they're thirsty. And
Mhm.
so that's actually the number one thing, and that's the easiest thing. Again, if you have neurodivergent or nonverbal children, then you actually have to look at other cues like urine output or just how they're acting to be able to figure that out. But for the most part, most kids will say, I'm thirsty, or babies will start crying, and you go through the checklist of why are they crying to try to figure that out. So those are the big things to look for there.
And then how long of being dehydrated, or at what point does it get so harmful that maybe a parent should contact their child's pediatrician?
Yeah, so we covered this a little bit above, but yes, it can be harmful. So dehydration is obviously not good for blood flow, not good for the kidneys, and so we do want to reverse that as soon as we can. And if the child again is sitting at home, cooling down, looks better, and is drinking, then for most dehydration, most kids can drink through that and are fine. And so back to the 10-minute window, you give them, you have them start drinking and you see where they are, and then you see where they are in about 5 to 10 minutes. If they're getting worse, then you probably need to make a phone call or bring them in. And so, or if they're just totally listless and looking terrible, back to the heat stroke we said, they probably need to go into the emergency room and just be checked out. Sometimes if you can't drink because you're vomiting, and you get into a vicious cycle of you have heat stroke and that's making you nauseous and making you vomit, you're not keeping down your fluids. If you can't keep down the fluids, obviously you're not going to rehydrate. So that's another reason why, you can give it a little bit of time, cool them down a little, just being in a cooler temperature. But then if they're still not able to take down oral fluids, then you're going to have to go to the emergency room eventually, because if we can't get it through your stomach, then have to get it through your vein in an IV. So those are we only have so many ways to reverse dehydration, and those are the two places it can go in.
Yeah. And now, speaking of pediatrician appointments, great segue to mention scheduling back to school appointments. It's not too early to schedule those to ensure they're up to date on vaccines and immunizations. So, Dr. Nunley, could you explain how important it is to keep our little ones on track with their appointments?
Yeah, so it's really important because we look at everything. We track growth and development, and we make sure that kids are up to date on their vaccines. And so the reason for tracking all this is so we can identify problems or anything that's popping up early. And if you can intervene on most things early, then that's a helpful thing. So it's never good to catch anything very late in the game, and always being able to identify or walk through concerns with parents is really important. So um, you know, I think every pediatrician has had stuff come up in well child appointments that the parent thought was okay, and then the provider identified as, oh wait, that's not quite okay. Let's talk more about that. So, again, really important to keep things on track. Sometimes once you hit you're a couple years old, it's a once a year touch base, but that's really important for us to do.
And then for those times when you can't physically go to the pediatrician's office, could you share what telehealth options are available at MedStar Health?
Yeah, sure. So we know that especially most working parents and most parents are very, very busy people. So we do have telehealth options for all busy adults with children. And so it's important for the annual wellness visits and the well visits to be in person. But when you have, children, things happen. So all of our pediatric offices have telehealth options for existing patients. So if you call in to your primary care office, they are able to uh, basically talk to you and see how we can schedule. Um, every pediatric or nurse practitioner or pediatrician has basically scheduled online appointments that they're able to do telehealth visits in. And so existing patients can always do that. And when you call your pediatrician's office or message them through the portal, then they can determine whether a telehealth visit is right for your child or whether it's better for you to come in person. And so, if so, our team will be able to guide you with your appointment and schedule a routine office visit. If your pediatrician's office has no availability, there is MedStar eVisit, and that's available for all new and existing patients. And that's an on-demand health option, and that offers video access to providers 24/7, no appointment needed. So that's available too.
Yeah, that's great to hear. Telehealth can be really great. It's a great option to have. So as we close, do you have any closing thoughts or takeaways that you would like our viewers to, take away from joining us today and hearing all of this?
Yeah, well, Sarah, I want to thank you for having me. It's been fantastic. And no, I mean, I think we've covered a lot of topics here, and I think this has been great. Raising children is tough. It keeps you busy, especially at like 2 and 3 a.m. when they're young. And it's a long journey with a lot of different issues along the way. And that's what we're here for, is to be able to help you through that journey and be able to say to you, no, this is something kids go through. This is normal, or identify things that we can say, wait a minute, maybe we ought to look into this. There might be something to this. So, yeah, that's all I have. But thank you for this.
Yeah, well, thank you. We, like you said, got a lot of great information today. So thanks again for joining us and taking time out of your day to answer our questions. And thank you to our viewers for joining us and asking your questions. And if you have any, if you want to learn anything more about our primary care options or pediatricians, you can visit our website, medstarhealth.org/primary peds. We'll share that link in the comments as well. Thank you again for joining us, and we'll see you next time.